Good morning and welcome to Primary Children's Pediatric Grand Rounds. I am Miguel Canaco, Pediatric Hospitalist and Course Director. And first, a brief safety story. Fluids were ordered at 51 milliliters per hour for a baby weighing 3.4 kilograms. The bedside nurse felt concerned this rate was too fast for this patient, about 3 or 4 times maintenance, and questioned the ordering physician about the rate. The nurse escalated the concern and the rate was changed to the appropriate rate. This is an example of the error prevention technique, stop and resolve. And this basic error prevention technique that we've learned has prevented the baby from getting a fluid overload. So the story has several lessons we can learn. Try to minimize interruptions when you're writing orders, because that's been shown to decrease errors. Making sure the weight you're using makes sense for the age of the patient, that's not an incorrect weight or you're on the wrong chart or something. Everybody has the absolute duty to speak up if something doesn't seem correct, and it's the doctor's duty to respond well. Whenever someone voices a concern, and make the psychologically safe environment, actively inviting people's concerns to be brought up. Now about the credits. So to claim credit within 24 hours, use code 7940 at Cloud CME. That's 7940. We will leave this recording up for several days at this channel and then move it to the archive at primarychildrens.org/grand rounds. If you see the red dot next to the live on your video, that means you're live. Maybe there's like a delay of 10 seconds. If the dot next to the live is gray, just click on the word live when you move your mouse around on the screen, and you can skip to right now if you click on live. Please type your questions and comments for Dr. Cowan in the live chat, and I'll read them to her and I can ask her these out loud. You have to be signed into YouTube, use your Gmail sign in YouTube to be able to put comments in there. YouTube filters out any comments with like website links or words that the robot thinks are spam. So if I don't read your comment, it's possible that the robot filtered it. And even though you can see it, I can't. That's possible. Certainly, if you want to ask something or comment along the way, go ahead and type it. You do not have to wait till the end, and we'll bring up questions at the end. So, okay, now for our speaker. Dr. Amy Cowan is Assistant Professor of Internal Medicine at University of Utah, a hospitalist at the Veterans Hospital in Salt Lake City, and we are grateful to learn together about racism, as uncomfortable or difficult as this topic may be. And Dr. Cowan has been teaching and publishing on this topic for many years. We appreciate you. Thanks for teaching us.
Thank you. And thank you for that warm introduction. It is such an honor to be here. I highly like Grand Rounds is something is very respectable, and so I take a lot of pride in being able to be here and honored to share with you what I have to share today. I want to start out by just sort of acknowledging that there may be some people in this very audience who are maybe a bit tired of this topic. The last 9 or 10 months has been challenging and difficult, and particularly among the sphere of social justice. And maybe you're just a little bit sort of ready to move on. And while you may not say it out loud in your heart of hearts, you're sort of thinking like, this topic again, really? And yet yesterday is such a reminder, such a strong reminder that this topic is actually so relevant. Or maybe you identify as a person of color, and this is your lived experience, or you identify as a white person, or the world perceives you as white, and you've been in this, doing this work, and you've been talking to your teams, and you've been really working as an advocate. Or maybe you're somewhere in the middle, and I sort of think of this in terms of a spectrum. And maybe you're in the middle somewhere in the last 9 or 10 months, with the lynching of George Floyd on national television, and the murder of Breonna Taylor, or the lynching of Ahmaud Arbery, and you've started to really realize that this is a problem, and you'd like to do more to contribute. And you've watched a few documentaries and read some books, but you're not quite sure if maybe you're doing it right. My ask today is that wherever you sort of fall out in this spectrum, and I call it a spectrum of willingness, that if you could stay open to the possibility that something I'm going to share today, or something that someone in the comments is going to share, is going to land in a way that is going to make you uncomfortable. Because it is when we are uncomfortable that we actually grow. I also want to acknowledge that this topic is tense, and it's tense for everyone, no matter your skin tone. I have no conflicts of interest, and I want you to know that I will be with you for the next 48 minutes doing this work with you. While I hope that you feel something, and I hope that you feel a little bit of discomfort, it is far easier to learn about racism than to be a recipient of it. Who I am targeting today, my audience, are those of you who identify as white or the world perceives you as white. You are who I'm hoping to connect to. I am a white woman up here, and there is no Black man to follow. There is no Asian woman on this panel because it's just me. This is not a anti-bias workshop or a diversity training. This is me really connecting with white members of the audience and asking you all to sort of wade into this discomfort with me as we unpack what does it mean to be white. And if it's not already clear, it will be in about 2 minutes. I am not a scholar, but I will do my best to credit the men and women, both Black and white, whose work I study. So I'm going to give you a prompt, and I know that there's a bit of a delay, so either use the chat or just think of it in terms of your own head. And what I'm trying to do is model for you one of my accountability practices. And this is how I bring this topic, this really sensitive, sort of red elephant topic of racism, to rounds. And so I will prompt my learners by asking them, what are 3 identities that you carry? And let me just share 3 of mine. But I have many, and my identities over time have changed, right? I used to be a medical student, then I was a resident, now I'm an attending. So 3 identities that I carry are: I am white, I am a woman, and I'm a physician. But I could also consider, I'm a citizen. Um, Maybe you're an immigrant. Maybe you're a refugee. Maybe it's your faith that you identify with, or your sexual orientation, or your sexual identity. So, thinking in terms of identity, what 3 do you carry? Then I will ask my learner, where are you the most comfortable? In other words, when you walk into that particular room, you feel like you can just take off your shoes and you are seen and loved and welcome. Now, for me, I have a lot of places where I feel really comfortable. Maybe for you, it's the place that you worship, or maybe it's your home, or maybe it's your parents' house. So, thinking in terms of where are you comfortable, I'm also really comfortable in my office at work. I feel like with my colleagues, I can say anything. Then I ask my learners, what are some places in your daily life, and I do mean on the daily, where you feel excluded and unwelcome? And maybe it's not explicit, where no one has said, like, you're not welcome here, but you can feel it. And particularly for my white male learners, this prompt is extremely hard because they are able to move through most spaces in their life without any discomfort. So as we move through this presentation today, I really want you to think in terms of, how do identities overlap and how might they intersect? In other words, what is the difference between being poor and white in America versus being poor and Black? And I will tell you, it is better to be poor and white in this country than poor and Black. What about the intersection of being white and gay and HIV positive versus being Latino and gay and HIV positive? What about being Black and transgender, right? So thinking about, when marginalized identities intersect, what is the consequence of that, particularly when there is racism? So just hold on to that. So I love this meme, and I know it's a bit dated because it's from last year, but this was me in April when multiple times a day I would have major meltdowns in April. I mean, I literally probably should have been medicated because COVID just completely hijacked my brain and my life. So it felt. And I think COVID did this for a lot of us, you know. In the spring, there was, and there remains, an economic crisis. People were losing their jobs, businesses were closing. Communities of color were affected much differently than communities that were white as far as mortality and morbidity. There was also a racial unrest, right, going on in our cities. Even in Salt Lake, there were protests. And so for me, it was just this like I came off the rails this spring, and I realized, you know, crisis provides this really unique opportunity to create something. And crisis also causes this discomfort, right? And I needed to be almost excruciatingly uncomfortable, probably because I'm so stubborn, in order to really change. And so, in thinking in terms of what happened yesterday, we are at another moment in our country of deep crisis, and yet it is the opportunity to do something, to talk to our learners, to empower them and inform them with not just the language to talk about this, but an opportunity to practice having these sensitive conversations. So I know that there are a lot of A plus people in this audience, very bright people. And A plus people tend to really like learning objectives, but I'm pitching those out the window in favor of expectations because expectations keep us socially accountable. And now more than ever, we need accountability, particularly from our leaders. And as physicians in this audience, you all are leaders. You're physician leaders. No matter where you are in this hierarchy, you're a physician leader. And so we are held to a standard. Um, and these expectations actually come from the work of Brian Stevenson, and he wrote a book called Just Mercy. And he talks about in his book how if we are going to dismantle racism, particularly within ourselves, we have to get close to the problem. And that means acknowledging racism, and then looking even within ourselves. This requires being uncomfortable, a willingness to wade out into the discomfort. And I will speak on behalf of all white people here that we do not like being uncomfortable. We will do anything we can to avoid discomfort, whether that be all sorts of distancing techniques, right? Like, I'm not a racist. I have a black best friend, or I'm dating a black woman, or an Asian man, or you know, I did a mission and I lived in Hawaii for 12 years. So we have all these sort of distancing techniques. Or we uh, do things like when we are corrected that perhaps that joke that we told isn't appropriate, we erupt. And you've all heard of the term white fragility from Dr. Robin DiAngelo. And we have all kinds of defensive strategies, right? We become angry, we deny it. If you're a white lady like me, you start crying. And so it's this willingness to be uncomfortable enough to want to change the status quo. Then we have to actually practice critical thinking. And we'll do this today. I've got some exercises we're going to do that I do with my learners. And that requires discipline to self reflect, and it requires discipline on the daily. This is not a one and done. I wish it were because it'd be so much less painful. Looking at how do I benefit from racism and how do I perpetuate racism, particularly as a white woman. And then it is changing the narrative. And this really means changing those stories that I have in my head and replacing them with truth. So if any of this sounds a little bit poetic, I'm going to be with you and we're going to work through it, okay? If anything throughout this presentation is new information or you're not quite sure about a term, jot it down and Google that later, because this is part of that practicing critical thinking, looking things up. So here are just a handful of real life, true story things that people have said to me over the years, white people. And so I've jotted them down because I want to share that these kinds of statements keep us from doing the work. They keep us from being socially accountable. I don't see color, I see everyone the same. No, you don't. And for the pediatricians in this audience, I know you'll appreciate this. Dr. Mary Ellen Goodman did research in the 50s and 60s on childhood development. She showed that children between the ages of 3 and 5 are aware of race and they know that it is better to be white. You see color, you just don't say it out loud. All lives matter. If you are hashtagging this anywhere, please stop. All lives cannot matter until Black lives matter as much as white lives. And clearly that is not the case in the criminal justice system currently. The final statement I'd like to share is, as a white man, I think I should just sit this one out. No, you should not. We need you in the game. We need you to show that you have skin in the game. I tell my white male learners, look, you will never experience racism, and you, I hope, are never the victim of sexual harassment. And it's going to happen around you. So if you hear about it, we need you to say something and do something, okay? Because last time that I checked, white men continue to have a lot of power and privilege in our society. So what is whiteness? And it can feel really invisible, almost sort of hard to describe and peripheral to race when you are white. Whiteness can also, because it feels sort of like it's peripheral to race in that it's not really my thing, right? Like race is what Michelle Obama has and LeBron James and Beyonce. But I don't have race because I'm neutral. That's actually the definition of racial indifference. I don't have to care because it's not my problem. In other words, race and racism is someone else's problem. So I can just, whoop, whatever. As a white person, I also get to define what is normal, what is the standard, whether it be in pulmonary function testing or GFR. I get to decide the standard for beauty, for intelligence, and superiority. I also get to determine what's real. So if you were a person of color and you come into my office and sit down and you're telling me a story that happened, that was, a racist incident that happened in your life, I get to decide, I think you're just being too sensitive. He didn't mean that. She just tells jokes that are, just ignore it. And then privilege. And this is something that oftentimes makes the little hairs on my learners' necks just sort of stand straight up when I mention white privilege. Here's the deal with white privilege. It doesn't mean that you haven't had hard things happen to you or struggle or difficulty. It just means that one of the things making your life hard isn't the color of your skin. I have never been asked, where am I from, in a way that was impolite. No one has ever asked me if English is my second language. I'm never racially profiled, and I can tell you that I zoom through TSA at the airport every single time, even when I'm late. So a few definitions, just so that we're all on the same sheet of music, because I think it's important that we're sort of talking the same lingo. Prejudice is essentially a story that I make up in my head about another group that's different than mine, okay, with very little information. So for example, a prejudice could be that gay men are promiscuous. Discrimination is when I act out on that prejudice. In other words, you're a gay man and you meet the love of your life and you come into my bakery to buy a wedding cake and I refuse to serve you. All humans have prejudice. We all have bias. And all humans have the potential to discriminate. BIPOC, Black or African American. I as Indigenous, and this could be First Nations in Canada, This could also be Native Hawaiian, Native American. POC are people of color. And that could be Asian or Latino community. Hold on to some cultural flexibility in that these names will change, right? In the US historically, Black people were initially, you know, Negro, then colored, then African American. Now it's if you're not sure, ask. Hey, and do it, with earnest, like sincerely, not just respectfully, but ask if you're not sure what someone wants to be called. I want to be called white. I don't like Caucasian. Race and racism, how I define these might be a little bit different for some of you. So stay with me. Um, Dr. Ibram Kendi, and Dr. Dorothy Roberts have written extensively on this topic. But how I'm going to define race is made up. There is one human race. Genetically, we're not honeybees or chimpanzees. Race is an invented term, and it doesn't come from ignorance. It comes because it's intentionally the stepchild of racism. In other words, race was invented to justify the transatlantic slave trade in the 15th and 16th century. If you had race, then you could have this hierarchy of human value. In other words, with white people on the top and African people on the bottom, Black people on the bottom. We created all these lies that Black people were the children of Ham, and that they were barbarian, that they were less than, and that colonization and slavery was actually in their best interest. There was a lot of money enslaving, and we'll go through that in a minute. Finally, racism, I want to really boil it down. Racism is a belief in the hierarchy of human worth. In other words, I believe that based on how much melanin you have in your skin, you have more value in society than someone else. That's it. That's all there is to it. So, excuse me. I like to bring art to my learners, and I found some work by the photographer Myra Green, and she wrote a book called My White Friends. And essentially, she created a book of photographs of her white friends in order to get white people to think about their own racial identity. So I'll often ask my learners, what about this gentleman codes, or this photograph codes it for whiteness? And some of the responses I get are that he seems very comfortable. He's taking up a lot of space, and that his legs are outstretched. He also seems maybe like he's wearing some designer pants. They're intentionally ripped over the knee. His shoes are nice. And then I ask my learners, what if we flip the script? In other words, what if we replace this white man for a Black man? How does it change? What narratives come up? What biases come up for us? And oftentimes, if my learners or myself are being honest, the narrative that comes up is, I might cross the street. I might be frightened. The narrative that I have of a Black man in a hoodie is that there could be some criminality. And so while no one ever told me explicitly this, I have learned this over time. What if we flip the script one more time, and now this wasn't a Black man in a hoodie, but a Black man in a long white coat? Might we then think in our head, or even say out loud, you are a credit to your race. Wow, look how far you've come. No one ever said that to me in my long white coat. I'm not a credit to my race. I'm an individual. So if artifacts like his clothing can be racialized, I would argue that spaces in our very hospitals can also be racialized. It wouldn't surprise me one bit if I ordered a coffee or a juice in the morning from a barista of color, or if there was a pharmacy tech of color delivering medications, or nurses of color taking care of my patients on the wards or in clinic. But as you move higher up the sort of food chain of academic medicine, there are spaces that I would argue are even more white than others, including the C-suites and including the OR. The difference it makes is profound, because if you're a medical student of color and your whole life you thought you were going to become a urologist, and now you go into one of these white spaces and you see no one who looks like you, do you think that makes a difference? Yes, it does. So this slide, if you pay attention to anything I have to say today, this is the slide. And when I have more, less of a time delay and we can actually have a little bit of dialogue, this is kind of a fun one. But I'm going to just sort of bore you with what I sort of categorize as a racist and a non-racist. And this comes from Robin DiAngelo's work, White Fragility. So oftentimes, you know, something will happen at work and someone will say something like, well, is she a racist? I mean, is he a racist? And so we're thinking in terms of binary, yes or no, right? Racist or not racist. And if I'm honest, I sort of think in my head in terms of what a racist is it's, you know, sort of uneducated and they're mean and they're doing this on purpose. They're saying these awful things on purpose. A non-racist, I'd hopefully identify a little more with. While I'm not young, I did grow up in Oregon and I do recycle. And I try to buy mostly organic, you know, it doesn't always happen. But it is this sort of dichotomy that it's either or. And what DiAngelo encourages us to think in terms of is that it is actually a lot more fluid than that. That this morning I could be presenting to you and trying to deconstruct racism. In other words, I am trying to be an anti-racist. And then this afternoon, I may witness something that happens at work and that's quite racist. Someone makes a comment and I'm just, I'm silent. My silence is racist. And so you realize that it is not set in stone. In fact, if we were to ask some of the Proud Boys from yesterday, you know, are you mean and poor and uneducated and do you do things on purpose to harm? No, they would consider themselves doing God's work. So you realize that when we move out of this binary system, either or, there's a whole lot more opportunity to actually change our behavior, to change our thinking, and to change our silence. So as painful as it is learning about American history, I'm really, really keen on it because I feel like, particularly in medicine, it is so important to understand where we came from to make sense of how did we get here. So the question I'll often ask my learners is, when was affirmative action first put into place? And a lot of them say, I don't know, maybe in like the 60s or 70s, 90s. And I'm going to show you the next two slides. We're going to buzz through some American history. And for some of you, it may be the first time you've ever heard American history framed in such a way. So this work comes from the work of Jeff Robinson. He's the director of the ACLU. I would argue that affirmative action actually took place back in 1619 when 20 enslaved men arrived in Jamestown, Virginia. We then notice that not in the South, but in the North, where I'm from, shipbuilding took off, and it was slave ships, and look at the names, because there was a lot of money involved. In 1662, Virginia law passes that children of slave women are also considered enslaved. In other words, if a white man raped a black woman, and that child had blonde hair and blue eyes and fair skin, they were still considered a slave. Converting to Christianity didn't entitle you to freedom. And a slave's death in 1669 was not a felony if killed while resisting a master. And I've highlighted this because I think it's really imperative to see how has history trickled down into the police force today. where the black body is seen as less than the white body. Multiple laws are passed. In 1755, white male employees and plantation owners form armed militias, sounds familiar, to threaten and deploy violence on slaves. They were outnumbered in the South. White people were outnumbered, and this is how they retaliated. And then in 1776, 41 of the 46 signers of the Declaration of Independence owned slaves. And so they had a vested interest to keep things the status quo. And it was an enormous moneymaker. Slaving and cotton were tremendous. It was later outlawed, and as you all know, in 1861, the Civil War began. And after the Civil War, there was this period of richness in our country called Reconstruction. And look at that, 700,000 Black men are registered to vote, and 2,000 of them serve as elected officials. Civil Rights Act actually happened in 1875, which outlawed racial discrimination in education and employment. This was later struck down by the Supreme Court. So this was a sort of like very short period of time. And unfortunately, I mean, we all know where the story goes, it doesn't end well. In 1877, President Rutherford Hayes is elected, and his platform is this: if I'm elected, I will remove the Union troops from the South who are enforcing the law that said that it was, that we could continue with Reconstruction, and really start to acknowledge and move on from our period of slavery. He won, Rutherford Hayes won, and he did just that. He removed Union troops, and now guess who was enforcing the law? Confederate veterans. And we regressed, and we had the Ku Klux Klan, white militias, black code, and Jim Crow laws are passed. If you're not sure what any of these mean, I would encourage you to Google search this. This became some of the bloodiest 80 years, and Black people were lynched, white women were raped, or Black women were raped, mutilated. It's mind-blowing, and it's absolutely shameful. I want to just sort of pause for a second. These are some photographs of what it was like, right? Colored waiting rooms, subdivisions that were basically excluded anyone of color, separate things. Architecture is also racialized during this period. This is a picture of Grady Hospital in Atlanta. And the wings that we're seeing that are facing us were wings A and B, and they were for white patients. And the wings in the back were for people of color. Not all hospitals, this is Jim Crow, so not all hospitals would accept people of color. And if they did, they were often relegated to the basement. And I added these slides last night because I think they are such a painful reminder of how important this conversation is and how much work we have to do. These in the lower corner are elected officials, and this has got to be just absolutely terrifying. These photographs are examples of white supremacy, and to call it anything else is just unimaginable. Showing Confederate flags in the background. I find it very disturbing, and I feel like as an American, I feel so committed to defending our democracy and protecting it. And this is an example of just pure chaos and terror. So I kind of wonder, what if we flip this script, right? Oh, wait, we have. Yeah, We did in June. Here's a picture of Black Lives Matter protest, and look who was there to greet them, the US military. Versus what we saw yesterday, there were actually pictures of white police officers taking selfies with these white supremacists. And so it's very different. Where at the Black Lives Matter protest this summer, we saw tear gas and rubber bullets and a big military presence. This is a huge problem. And until we talk about this, we cannot change it, right? We have to be able to talk about it. And it's sensitive. So I'm going to check in because some of the feedback I've gotten when I've done this presentation is, you just sound so angry, and could you just change your tone, just bring it down from an 11 to an 8. And I am angry, and I didn't sleep well last night because of what's happening in our nation's capital. And I'm disappointed, particularly when my learners who are white tell me, well, you know what, the system is just broken. I just outlined for you white affirmative action. The system is not broken. The system is working perfectly with intention. We have to change the system to be more inclusive. And this is a great line that a white woman told me about a year ago. Could you just not say the word racist or racism in your next talk? Because I really think you'd get more people to listen. And I would argue we actually have to use words to describe what we're talking about. Because when we don't, the problem is we blame behavior. We see this all the time. Well, morbidity and mortality among communities of color that are affected by COVID is because they made bad choices. That's a problem. That's toxic thinking, and that is a prejudice, a bias. I'm going to move past this slide just in the interest of time, but essentially it just is a nice visual from the New York Times breaking down how 80% of the US leaders are white and only 20% are people of color. Yet if you look at if you look at the actual percentage, there's only 60% white people in the US. And these are leaders not only politically, but deans of major institutions and people that we buy books from and consume news from and own sports teams. This is another picture by Myra Green, a photograph of a friend of hers. And I really like it because I feel like it really codes for whiteness. And I almost feel like she could be a colleague. We could work together. She could be a medical student or a physician. It's interesting because she doesn't identify as white. She identifies as Jewish. And so then you kind of get to this question of who decides what's white, right? Who decides what's real? And again, kind of going back to whiteness, do white people decide if you are Black enough, if you are too Black, if you're white, if you're not white enough? So just sort of food for thought. Couple of slides about medical school. So this is dated from a couple of years ago. And often when I present this, people say, well, Black students to white students, it's like 14%, but you're not looking at the denominator of the whole picture. Black students compared to the whole picture of the total number of students enrolled in 18 to 19 is 91,000 is the denominator. And so 6,000 into 91,000 is closer to 6 or 7%, which isn't a true representation of our country. And then you look at the discrepancy among faculty. Well, that's interesting. And if I didn't have the language or the tools to be able to talk about this, and if I wasn't practicing critical thinking, it'd be really easy for me to blame behavior. Well, maybe Black professors or faculty just aren't into academics, right? They just didn't cut the mustard. Or I could do the background research and learn about why is there this discrepancy. And it comes down to the Flexner Report. So this was created by the AMA, the American Medical Association, in 1904. And it was continuing medical education. So it's been around for a long time. And they wanted to basically revamp how we educated medical students. And so the Carnegie Foundation in 1908 hired a man by the name of Abraham Flexner to do research on this problem and make recommendations. Flexner was not a scientist, he was not a researcher, he was not a physician. He was a bigot, and he was very outspoken in his bigotry. He hated Black people. He thought that they carried disease and that they would basically harm white people. So he went around and investigated medical schools. And at the time in 1900, there were 155 medical schools, many of which were not affiliated with a university, they were freestanding. In 1910, he presented his report, and you know it's not going to end well. He essentially said that only white men could go to medical school. So if I had been applying then, I would be out of luck. And that you needed to have a 4-year college degree in order to apply. And so that immediately excluded people who were poor, right? Because now you needed money to be able to go to university. So a high school diploma or an associate's wasn't enough. He then said that all freestanding medical schools needed to close immediately, which took that number from 155, like 10 years later, to 33. And at the time, maybe you're thinking like, well, no big deal, right? You just apply to 33 schools. Well, except that this was the time of Jim Crow. And so you weren't allowed, if you were a person of color, even if you were a man, to apply to these white institutions. And so you were kind of you had to go to a historically Black university, which a lot of women also applied to. This left, at the end of this situation, this left Meharry and Howard as the two schools that were now had to train all of the Black doctors. And you can imagine that's not possible, right? A little ditzel here on the AMA. The AMA historically has been very racist. Their policy has been racist. They have excluded, until they've had to integrate in the 1960s, Black people and anyone who was basically affiliated with historically Black universities, like women. So what difference does it make, right? Like, as a professional physician, I'm not a member of the AMA right now, a national organization, but it made a lot of difference back then because you had to be affiliated with a national organization in order to oftentimes be able to pass your licensing in the state you wanted to practice, to be able to get hospital privileges, to be able to do a fellowship, sometimes to be able to do a residency, certainly to do continuing education and have it be meaningful. So it was a big deal to exclude, and they did it intentionally, right? This was racist policy. So kind of moving on, and I'm getting closer to the end of my presentation, so I'm hoping that there'll be some good dialogue. I have been looking for a house because I wanted to, sort of come on into the housing market. And this house was for sale in the Salt Lake area. I think it was like $150,000. I did not buy it, but I think it's a perfect example of weathering. And weathering is a theory that I want to share with you that comes from the work of Arlene Geronimus from 1990s. And you can see how hammered from wind and weather and sun and just years of neglect. Looks a lot older than it probably is. So weathering was a concept that essentially when an individual is experiencing stress, repeatedly on the daily, it starts to affect our genetics, it starts to affect our health, it affects our ability to fight infection, and it affects our hormones. And in the 90s, everything was sort of thought to be, well, it's just behavioral, or there's some sort of genetic differences between white people and Black people. But what Geronimus kept finding was that among her Black women that she was, the Black women she was studying, when Black teenagers got pregnant, they did better than women who were, let's say, in their 20s or 30s, who were also Black. And so she hypothesized that the burden of racism was actually weathering these women. Now, if you're thinking like, that's a cute theory, Dr. Cowan, they've actually done research on this, looking at white women who are the primary caregivers for severely autistic children, and they found the same effects. So as I move through the next couple of slides, think in terms of how does weathering play out in these situations? Postpartum racial disparities, we know that Black women are 3 to 4 times more likely to die than white women. And I would argue that it is our inability and our racism, our racist decision-making, and our biases that somehow Black people and the Black body is somehow different than white bodies, that they experience pain different, that they bleed different, that their vital signs when they are tachycardic and hypertensive and tachypnic, and they're experiencing heart failure and PE. Yeah, this is a public health outrage. Infant mortality. Looking at Black babies are 2 times more likely than white babies to die. And my learners, my white learners, they will often sort of argue with me, you know, when we discuss this on rounds. And they'll say things like, well, Dr. Cowan, it's just socioeconomics, right? And I wish it were that easy. I wish it was just like, oh yeah, if we just give, you know, Black people pharmacies and access to healthcare and reliable transportation and jobs where they're actually making a good wage, then none of this would happen. But actually, when the research is controlled for education and money, it doesn't make a difference. In other words, Black women cannot buy their way out of this. They cannot educate their way out of this. It's not socioeconomics, it is racism, and it is in every system. And so even if we really did a great job today of cleaning up you know, medical education, or we cleaned up healthcare, it is still in these other systems that intersect with that, right? It is still in banking and lending. It is still in housing. It's still in education and the criminal justice system. And so I would argue that it's really a groundwater theory in that racism is in the groundwater and it is percolated up into our rivers and our streams and our ponds. And it's when we brush our teeth, it's the water we brush our teeth with and drink and shower in. It's all around us. So my last slide, how am I doing on time? Not bad. Is essentially sort of thinking in terms of an anti-racist framework. It is not enough to be nice. I wish it were, right? Well, I'm just nice. I wish I was nice. Nope, you actually have to, you have to do more than being nice. We need more white people to look at policy and then go to your dean, go to your supervisor, go to your CEO or CFO and speak on behalf of people of color and say, hey, this isn't working, not for me, but for other people, right? We need to look at our thinking and how does our action or silence, how does it actually work to deconstruct racism? And then I'm going to challenge you in the audience, particularly white people. What are your accountability practices? And let me tell you right now, a book club doesn't count. Okay? I can't tell you how many book clubs I was invited to join when things went down this summer with racial injustice. Um, Book clubs are nice, but they keep us up here. And I am asking you to feel something, right? To get in your body, to wade out into that discomfort. Um, Accountability practices, let me just share a couple of mine really quick. I talk about this every single week when I am on service, every single week, because there is so much going on in our worlds around us that affects our ability to practice at the hospital and in our clinics, that we have to be talking to our learners about this. We have to be normalizing these conversations. I took care of a patient with an asthma exacerbation, and we talked about racial disparities um, among communities of color. Our patient also happened to be an Indigenous man. So it is on us to start modeling this. It doesn't mean I'm perfect at these conversations. It doesn't mean I'm an expert, because I'm certainly not. But it means I'm making an effort. I'm bringing in short stories and I'm reading part of them. I'm reading um, snippets of books that I'm reading. I'm sharing with my team. We're having these conversations. Another accountability practice, I did buy a home this fall, and it was really important to me that some of the bids I wanted to get on this house, that I gave some of those bids for some of the work, the projects went to people of color. When I have an issue that I'm working through in my head, I don't just, text my friends of color and just ask like, hey, can we meet up for coffee? I want to pick your brain. No, I set up a time. We discuss what I need to discuss related to race and racism. And then I Venmo them money, because particularly for Black women, this work is exhausting and they need to be compensated. So thinking about, those are some of my accountability practices. Um, I vote. Um, I speak up, but it is not enough to poke a little sign in your yard to support BLM. The final thing I will say, and then I will stop talking, and it is that if you think about how we talked about the intersection of identity a little bit earlier, it isn't enough that I'm going to be anti-racist to help people um, who maybe don't look like me. But I also have to be anti-racist for trans community. I have to be anti-racist for LGBTQ, right? I have to be anti-racist for Muslims. I have to. So it's like it's really sort of bigger than just like, oh, I want to work for social justice. It's like, yeah, and I need to work for communities even when they challenge me. The final thing I will say on accountability practices, because I just thought of it, that I do, and then I promise I'll shut up. A recommendation for white men anymore, not for white men, because I really want to elevate women, and I want to elevate communities of color, and I want to elevate identities that have been marginalized. So that is another example of an accountability practice. I have shared a lot, and I've been hopefully you've been able to sort of identify or relate, or it's been affirming some of the things I've said. I hope I made you uncomfortable, because that was my goal. Here's a very anemic list of learning resources. Take a screenshot, check them out. You can email me. I email every single person who emails me. I email you back. And I thank you for the time. It's been an absolute pleasure.
And thanks for teaching us. I'd like to start with just a few of the comments in the live chat that Dr. Cowan's not able to see that right now, but the only ones we have there are some of the identities. It was interesting. I'll just kind of read this to you. Daddy, doctor, and Latino, but many others well. White transgender father, Black physician son, woman, Jewish, white, woman, Latina physician. And, we had well over 100 viewers this morning, and so many intersecting different identities. And as a pediatrician, in the photo of the woman you showed, the woman who is Jewish, and my eye was also drawn to the high chair. I can see a little bit of the high chair, thinking about the baby and toddler out of view, and perhaps she's a mother as well. But I was really interested in the history part, and learning about the racist policies in our medical institutions, and how it was designed, how there's racism in that system still, and and weathering. I learned about weathering. I hadn't heard that one before, that term. Preventing, I think, seems like preventing weathering and asking about and addressing the racism related kind of health is part of our concern as pediatricians. It's in our
Mhm.
Academy of Pediatrics policy on racism to
Right.
try to start asking about how is racism affecting your in your life for our patients.
Mhm.
And then as pediatricians and the AAP, we are horrified at the treatment of babies and kids at the southern U.S. border as well.
Mhm.
Let's see what any questions coming in. Okay, how do you address a racist or sexist comment by a parent, making it clear that it's not acceptable while still keeping the focus on the patient, the child, and preserving the therapeutic relationship? Or is it not possible to have all those things at once?
Oh, absolutely. No, it's always possible. We get to be creative. There's lots of different strategies. One of the strategies, so I work at the VA and I have an opportunity to practice calling out bad behavior frequently. And I usually just do it really directly. We don't tolerate that kind of speech here. Now let's focus on this little baby of yours, or let's look at these diabetic foot wounds, or so I'm sort of, being very that nurse is a part of our team, and I expect you to treat her or him with respect. And so I'm very, very explicit in that language, that behavior isn't tolerated. And then I circle right back to, I don't turn this into this is not the time for a teachable moment. And for the most part, 9 times out of 10 people they'll reel it in. And if you need to remind them again, you can. Um, but hopefully that helps you.
Good. Yeah, that seems like it takes some practice. Brief, professional, explicit. Bring the focus back.
Yes,
Kind of like redirecting anyone really.
like an infant, and knowing
Uh,
that, like, or
right,
sort of dog training, and knowing that, like, I'm not saying like you are a terrible person, blah blah blah.
right,
I'm just like that kind of speech. That joke's not funny. Let's refocus here.
right. Um, then, because we know from the research you talked about that babies notice the differences in skin color, how do we help them grow up to be somebody who fights racism? Like with your own kids, at what age do you talk to them about racism? Do you focus on positivity, stories about amazing people of color, and normalizing their excellence? Do you talk about unfairness? Like, how do you kind of and I know you aren't a pediatrician, but as somebody who thinks about it a lot. I mean, we want to know about
Yeah,
that as well.
I would say that it needs to be on every table, and it needs to be talked about all the time because children pay attention and they notice. And so just checking in with them and reading to them. And I know that Primary Children's has, I've heard that there's like a book drive, or that there's definitely books that are available for our patients. And so making sure that there is a whole spectrum represented. And really, as you as a parent, as you're learning about your own racial identity and as you're deconstructing your own racism, um, you're going to start seeing it everywhere. And you're going to find all kinds of opportunities to discuss.
Great. Um, one of our let's see here. One person says, "Thank you for so much for your presentation. It was very instructive." Another, "This is a fantastic presentation. Thanks for guiding us and walking through this journey together. Really appreciate your honesty and vulnerability." Here's one, Dr. Cowan, as a Black physician in Utah, how do I best recruit white ally physicians without frequently causing the white guilt? Because I find this problem often.
Mhm. Um, that is such a good question. Can I think about that one more? Because I'm actually I don't I don't I don't know.
Sure. And I can
And I think
connect you with, go ahead.
Yeah, and I would also, and maybe let me just sort of, I don't want to just be sort of reactionary, but thinking in terms of, if there's white guilt, that's not yours, right? That's on them. and maybe they have to feel some of that, right? Like maybe that's their work, but that's not that's not on you. That's our work as white ladies.
Okay. And I could connect you with Dr. Ferguson. We could connect you together.
Sure.
Yeah, you could email her email in there if you'd like to email, have more conversation. Another one, thoughts regarding patients and parents who say they don't want a caregiver, which is what we call our doctors and nurses. They don't want a caregiver of a particular group.
Hmm. Yeah, I mean that is racist behavior, right? And we don't tolerate that. And so I would hope that at your institution you would have policy that would be anti-racist and would be very clear that you are supporting all of your caregivers, no matter their skin tone. So that needs to go to leadership.
Right. Okay, and then we're out of time. We could hang out a little bit longer after the end of this, kind of pretending that we're going up to the podium talking with you socially afterwards. But the last few comments, Dr. Tam says, "Thank you, Dr. Cowan, for your time and talking about race. That race is part of everyone, not by any biological means. It's the impact that makes it different. And thank you for your presentation and sharing your knowledge, especially after yesterday. The timing was really important." So that concludes this. You see the claim credit code 7940 up there. Okay, now is the after the end of it, and we're just kind of talking together some more.
Okay.
Dr. Tam also asked, what do you say when supervisors are not receptive to the prejudices and discriminations that they're made aware of, that they kind of blow it off?
I would say keep moving up the chain of command,
Okay.
right? Because again, your facility should have policy, and don't stop. Don't stop, because this is how we're going
Excellent.
to actually change it.
Right. And at the very top of the chain of command in primary children's and Intermountain Healthcare and in University of Utah, we do have quite a strong commitment
Yes,
from the top leaders of each one.
yes.
Um,
I've also, just really quick, I've also gone to leadership personally and asked, like, am I going to get called into the principal's office if I ever corrected a patient or a family and, sort of practice these boundaries? And I've been told, no, absolutely not. We want you to, because you're creating a much safer community of practice and a safer space for all of us as caregivers to work. So if you do it with respect and if you focus on the behavior, um, you'll be supported.
One person recommended regarding talking with kids, they recommend Trevor Noah's book, Born a Crime,
Yes.
for the kids version, maybe at the 12-year-old age group. I like that one on audiobook because he's so funny and entertaining as
Yeah,
well.
he's great. I
Yeah.
I do like that. I read the adult version.
Mhm.
Certainly. Yeah.
Yeah, I didn't know there was a kid version. That's pretty cool.
Yeah. Yeah. I haven't read it. I
Uh,
should probably check it out.
okay. And we see some other learning resources. We're showing the claim credit code right now, but the white fragility, me and white supremacy, seeing why, developing your own accountability practices, places to support. Okay, excellent. Well, thanks again.
Oh my
Thanks
gosh.
for
Thank
teaching
you.
us.
Yeah.
Really appreciate you. And each year in Grand Rounds, we are going to continue to address this topic, and in different ways, and different things to learn. So
Yeah.
we
And
appreciate you
maybe,
so much.
another accountability practice could be just having a journal club with, one of the journals or one of the articles is focused on some of these topics.
Right.
So,
Exactly.
yeah, great. Well, thank you
Right
so
on.
much. And then put me in touch with that physician if it's possible.
I
I
sure
haven't
will.
seen
Yeah. Yeah.
any of the comments, so
Right.
send me her email.
Excellent.
If you think that's appropriate, I'll leave it to you.
Yeah. Okay. Sounds
All
good.
right. Thanks, everybody.
Bye.
Bye now.